Welcome to our Mother's Health podcast. In today's episode, we look at how traditional practices and misinformation continue to shape maternal health outcomes, sometimes saving lives, but often putting mothers at great risks. So it's our Mother's Health podcast, and I'm Dr. Vivian Chinwa. I'm the host and creator of the podcast. So the title for the podcast today is Tradition and Truth: How Misinformation and Cultural Practices Impact Maternal Health. Many traditions surround childbirth carry deep cultural meaning, but a lot of them may pose risks to women. Practices such as restricting women from certain food is very common in many developing countries. Also, delay in getting hospital care or over-reliance on traditional birth attendants can endanger mothers. And there are some other traditions that are very protective, such as postpartum rest period. I'm sure a lot of you from maybe Nigeria or other countries will be familiar with the fatting room. After the woman gives birth, they are allowed to stay indoors for a few months so that they could get a lot of weight and all of that. So there are so many traditions out there. And many of them may need adaptation, especially with modern medical knowledge and current research. We are seeing that we need change. I'll share a few stories before I introduce our guest. We have Mariam's story here. Mariam is a 19 years old first-time mother and was advised by elders, I must emphasize by elders, to avoid hospital delivery due to fear of evil spirits. She labored for 3 days at home before complications, and then it forced her to seek help. She survived, but the baby did not. And we also have Grace, another story from Kenya. She was relying on herbal remedies for excessive bleeding after childbirth. In episode 2, we talked about postpartum hemorrhage. And just now, I'm just thinking how unreasonable this can be, that someone will use herbal remedies to deal with postpartum hemorrhage. And a neighbor eventually intervened and rushed her to a clinic, and she narrowly escaped severe hemorrhage. So these are some of the stories amongst many. So misinformation spreads through social network, a lot of the times through Facebook and all of the social media platforms, through traditional leaders. And there are a lot of myths around contraceptive, infertility, hospitals, being unsafe, and a lot of myths. So I'm going to invite our guest. This is a very special guest and very knowledgeable in maternal care. We're going to invite Miss Maureen Ediozo. She's the founder and executive director for Second for Good charity initiative, S4G. I'm just going to leave some of the links to her charity and her page so you can view some of the great work she's been doing in maternal care, and you can support her project. This is a non-profit tackling maternal mortality in underdeserved Nigerian communities. Pardon me. Under her leadership, S4G has provided free antenatal care to over 200 women and delivered reproductive health education to more than 1,000 students. And this is really incredible. I must applaud her for her great works. She's a chartered management consultant in Belbin regional representative for Nigeria. Maureen has expertise in trade reforms, service delivery, organizational development. She coordinated Nigerians' Export Expansion Facility Program, EEFP, driving record-breaking 4.8 billion non-oil exports in 2022. Experience spanning the NEPC, DFID, UNP, and DP, which is the United Nations Development Program, and British Council. She now leads the MCI and Partners Limited. Well, welcome to the podcast, Miss Maureen. I'm so delighted. It's an honor to have you. So much experience there and so much work in maternal care. So I'm very delighted to have you.
Thank you very much, Dr. Vivian. It's really great to be here. I'm happy to be here.
Yeah, thank you. So we'll start by talking about some of the common myths around pregnancy and childbirth. With the incredible work you're doing for S4G, I can assume that you've come across so many myths around pregnancy and childbirth. I don't know if you want to share some of your experiences with misinformation and traditional practices that are harmful to women.
Okay. Well, I've heard, thank you for the opportunity and good question. I must also applaud you for having this podcast because I think that a lot more people need to come into this space. In Nigeria, maternal mortality is a crisis. Unfortunately, it's not treated as such. So we continue to see things that dishearten us out there in the field. There are so many little things that can be done right in order for women to actually, that makes a difference whether women stay alive or they die through childbirth. So yes, some of these myths, misinformation practices, some go from cultural beliefs to religious beliefs. Some is also about women also trying to prove that they're strong. There's no need going to the hospital like I can deliver at home. My neighbor did. Yes, you've had situations where one has said, oh, she was due. We had her EDD was the following day. And when my volunteer team saw her, the doctor said, oh, she was actually ready, dilating already, and needed to be in the hospital to go and deliver. And she said, no, there is a health center not far from them where one of the same members, this was in an IDP, internally displaced people's camp. So there's one in Abuja that we go to and deliver free antenatal care. The woman. Wow. And so one of the fellow residents has said she went to a health facility and baby died. So they have this myth and they think that they're overtaxed in terms of funds. So they don't have the 1,000 that they need to pay. You find that some of these healthcare centers also ask these women to come weekly for antenatal care, and then they charge them every week to run the test and to pay for every time they go. So this keeps them from going. Economic reasons, there are myths also, and then there's the preference for traditional birth attendants. I must say also that there's also misrepresentation of the position and the skills and qualification of healthcare workers in some of these communities. So you would find the community, maybe there's a resident health and environmental worker called CHOOSE, and that person is deferred to as a nurse. But they're not really nurses and midwives, but they're the ones who then take delivery in these places. Yeah.
Wow. Yeah.
They take delivery, they come to the home to see them. So we say, oh, there are some women we have supported and we see they're almost due. And we ask if they're going to go to the hospital, and they say things like, oh, no, will not. So would be the one to deliver me at home. Then in some cases too, the male partners or husband tell them not to go to hospital. So recently we had engagements with the men in the community where we work. And a few of them said, no, their wives give birth at home. They don't go to the facilities to give birth. And also the health centers are not open 24/7. So after 4:00, what happens to the women? So you find that some of it is self-help, some of it is misinformation, and some of it is just ignorance. So it's a whole basket of things that we've come across.
Yeah. Do you think there's a place for tradition? Because we don't have many facilities that are caring for women, and a lot of times some of our facilities are under-equipped, and they had bad practices in hospital settings, so they try to into these traditional practices. That's what they can see, and just hope for the best, especially for faith-based people, especially people that are religious. They just want to hold on to those practices. I hear a lot of people going to these maternal care practices in churches, and they say they rub their stomach, they reset their stomach and things like that. Is there a place for those things?
Oh, there is. So a lot of, so you see, for instance, where I come from, back in the south of Nigeria, there is a primary health center and there's a general hospital, but then there are villages stretched far and wide. Yeah. And those people have no connection with any health center. They can't even travel to go to the health center. So in those places, traditional birth attendants are the people who deal with the pregnancies. I recall going to my mom's village. Then there's a lady who was known for that. That's all she did. You would always see women, they come in to check tummy, and reposition the baby.
Yeah.
Yes, and then when it's time they deliver, tie the umbilical cords and all that, and that's it. So there's space for these people. They've been there for a long time.
Mhm.
Yes, they have to deliver lots of babies, but a lot of mortality and a lot of casualties have also come through that process. Because of course we know modern practices, so they have no idea or no way to find out if a woman is anemic or if there is a hepatitis B present, which could also infect the baby or the woman. So there are a number of things that they can do. I think we cannot totally disregard them because there's definitely not a gap. There is definitely a gap that the government has not been able to handle, to take care of. So when there is no one handling that, someone fills in and takes that space, which is unfortunate for some of the people because everyone deserves quality health care, to be honest. At least basic minimum is lacking. There are a number of reasons, from ignorance, real economic reasons.
And a lot of people are advocating for collaboration between these traditional attendants and modern medicine for them to come together and work together. Do you think that would be a solution to some of these problems if there's effective collaboration between them?
Yes, I think if it's a collaboration that can work, but I am yet to see how it will work. It's been said, it's all over the place. When you talk, they say we should train them. How much can you train them to see, for instance, that twins are in one sack or two? So you still need the modern practice of the X-ray. So what is the system where do you refer? Where do you have the cutoff? It's a very thin line. So at what point do you say this issue can be totally handled at TBA, traditional birth attendant level? If a woman is going to have hemorrhage or she already has preeclampsia, the signs maybe, how does she? So you have to still give them medical training. How far can you go with some of these people to give them that training in order for them to really stand in the gap in a way that it's successful for everybody, the right outcomes achieved at the end of the day?
I think a lot still needs to be done with regards to research, isn't it? For people to research that area. And I agree with you that it's been very difficult to collaborate because some people have very strong values and cultural practices. Maybe they use certain herbs and they use certain things, and then you tell them you can't use this, and they know their forefathers used those things and it worked, or they have used some certain those procedures and it worked on so many people. So it's very difficult, but I agree a lot of collaboration is needed and research in that area. How do we create an atmosphere for collaboration where these traditional birth attendants or these practices can be reviewed by some of the doctors and advise them to say, if you see these signs, you can start advising your patients to go and seek appropriate health care. So these are some of the things that I think can be done. So let's go to misinformation. Access to information and respectful education. I'm very glad I saw that you're training people on misinformation. What more can be done? How can we challenge misinformation? And how can we provide respectful, accessible education? Because that's what you're doing anyway. So I'd like to hear more about that.
Yeah, so the issue of misinformation, as you can tell, as you would know, is that they can actually be very dangerous. They can have dangerous outcomes. So an example of one misinformation, we had our antenatal outreach and some of the women tested positive to hepatitis B. And when our volunteer doctor, luckily, is a consultant obstetrician, so she's got the right level of knowledge and expertise to deal with this. So she's actually works in a teaching university. So that is her day job. That is what she does for a living. So she's really passionate about what we do. And so she asked them, so what have they told you about this? And where do you expect to have your baby? She said, oh, they've told me it comes up during pregnancy and then it disappears as soon as the baby is born.
Oh, wow.
So my daughter was like, what? But that's not true. So it doesn't just disappear. And then also that you now have to take precaution because she said, where are you going to have the baby? I would either have the baby at home with the nurse, who is the nurse in quotation marks. So I either have the baby at home with the nurse or I will go to the primary health care center Now, the primary health care center would not have the vaccine for the child, hepatitis B vaccine for the child. And also, if they're not aware, because they don't do that test at that level. So we do it when we go on our outreach. So besides the routine medication, we also do the testing for them. We also do counseling to whatever we find out from the test results, hepatitis B, blood count, and all of that, HIV. So we counsel them. And so the doctor say, well, you can't have this baby at home because you also put the attendant at risk. So there is all that they don't take into consideration. So it could lead to disastrous outcomes on all fronts. The thing is, well, we were there a few weeks ago. There is a lady who had been to one of our outreaches, and she came in. She was there at the time we saw her back in June or so. She was heavily pregnant. She said she was carrying twins, and so she asked for 2 delivery packs. So that's how we registered her in our head, because she said, "Mine is I need 2 because I'm carrying twins." Anyway, we go to this center, and this woman is there. She's in labor, very painful labor. And the attendants there are getting ready to deliver her in that facility. And the doctor said, "You're qualified to deliver twins in a health facility like this. They're supposed to be in a secondary hospital." And so luckily the husband was there, but it took a long time. He wanted the woman, his wife, to have the baby there because he didn't want to go and pay whatever he needed to pay in the hospital. Or he also was not aware that there was no doctor, because these places don't even have doctors working in them.
Wow.
So yes, they don't have doctors where we've gone. No doctor, no full-time midwife or nurse. And if the midwife they have is even ad hoc, she hadn't been there for a few weeks. So it just tells, so they say they call her when there's an emergency. So these people, there's such a knowledge gap between the people in the communities and the truth of what can happen. At the end of the day, we had to sit the man down and talk to him about why they needed to move from that primary health center to a hospital, which he did quite reluctantly later in the day. The second baby had a little bit of an issue, but they delivered both successfully. But thereafter, the second baby needed incubation and all of that. So we've been following up and they're okay. But it just tells you how making the right decisions can be affected when there's no information that is required. And also the danger of the people not being sincere enough, that's the people at those centers, to own up to what their own capabilities are. You don't have nothing to look after an emergency at a theater there. You can't handle anything. If you needed a CS with a child, you wouldn't be able to handle that. And the worst part of this situation was that the lady's first scan had the fetus in two sacks. And by the third or so scan she had, they were now in 1 sack. And the doctor said this is not biologically possible to move from. So this even highlights, I think it's a red flag that there's something is not right. And you still want to take that delivery in a primary healthcare center. So besides the poor information, there's also poor supervision, regulation. So the government is not, these facilities are there, but
so you are saying poor supervision and monitoring of healthcare. And I'm just curious, this is Abuja, isn't it? So these things are still happening around. Are these the village areas that all of this, or is it in the town? Or I'm curious to find out.
In town, so the legislative quarters we have, well, they still call it that, but that's where our legislators used to live in Abuja. It's about 5 minutes from this place I'm talking about, less than 10 minutes from there. The presidential villa is less than maybe 20 minutes from this location. So it's right in Abuja. It's a semi-urban area.
It just tells that people are just adamant about this and not giving it serious consideration. But it's good that we are talking about this so that people can begin to gain more understanding and awareness. I think a lot needs to be done, and this needs to be taken seriously, because I'm just shocked. I'm thinking, when you're speaking, I'm thinking it's somewhere in the remote villages. So I'm really shocked to hear.
So in fact, I'll tell you, at the start of the program, when we tried to explore, to see what's available and all of that, we went to 3 primary health centers in Abuja. That's Abuja. So all 3, one of them maybe 30 minutes outside of town, but it's also is where most of the people live live in and come to work from. And all of them had no medical doctors.
Wow.
One of them said they had a medical doctor they call whenever they need to. But all the other ones, and then one of them had a full-time midwife. But all the other ones didn't have.
I think most of them have migrated.
Yes, they've migrated. But the thing is, a lot of them have migrated, but we are trying to now push to see if there is any other way, because the doctors in training that could be used.
Exactly.
So we are to propose and push for that.
Our population is large. We can still train people, like here in the UK, because also they need lots of doctors and medical practitioners. So what they've done, we have nursing prescribers, people that are trained to start prescribing. We have a lot of support for our doctors these days. The pharmacists can also prescribe, and they train them to do all of these things. So the burden is taken off the medical doctors. We have nurses that act as doctors right now in the UK. So these are some of the strategies that they are using to try to provide more skilled workers in healthcare. So this is something that they can do easily.
Easily. Honestly, I think for me, is the fact that there are solutions are not being thought through. There is no real intention. Maybe there is, but we're not seeing it in the field. Enough of it. If there is, I haven't been to one that is where it's working at the moment. So they need to do a little bit more and to be seen to be doing that so that we can have some confidence. So we went to see the chief of the community, because after seeing that center last month again, my first visit there was a year plus ago. So I went back there. And I said, we have to go and talk to the community chief, because this is a facility in your location, in serve you people. So you should be interested in what goes on there. If you need to go and talk to the government, then you should do that. Are you using the place? And right there, one other person had some experience to share, how he had taken his daughter there, and the injection they gave to her put her straight into a coma. So you go there and you're wondering about the sanitation, about the lab services and everything. And you just could see everybody is the same. They're all well choose. So there's no senior to us. We do what we want. And so that is a bit concerning and requires attention, to be honest.
And this is happening all over. It's just not here. Many low income settings. This is what we get, which is really not acceptable.
The people already are not, maybe, how would I say, the poor or whatever, disadvantaged. And then to add this to it is actually, it's not right.
Exactly.
At least let it work.
And this is solely one of the main reasons for the high rate of maternal deaths, I believe. Lack of emergency obstetric care and monitoring, proper supervision of people. Now, I'm going to go to the final question before we wrap up the podcast, which is about how do we support women's right to make informed healthcare choices? Because I know in a patriarchal society, their husbands are there to make decisions. Like you said, some people tell their husbands will tell them you can't go to tertiary hospitals, you must stay here, or you must use traditional practices. How can we support women's right to make informed decisions? A lot of them don't have the confidence, and they don't even know their rights, first of all, and they don't even have the confidence to make decisions for themselves. And all of these misinformations all over. It's scary because we know the consequences of it. So how can we do this?
So I think what we are trying to do is to also get the men on board. That is one way to reach the women and to help them make some of these decisions. Of course, some are economic, but also just the men understanding what the situation really is, and them knowing that their wives are not being taught to challenge them, but just to help them help the situation better. So we had a very positive response when we went out last month to engage the men in the community. And to get them to be part of even the antenatal care visits and all of that. And they were like, wow, we didn't know about this. We're even encouraging them to sign up to health insurance for their wives. So that can help protect the women and give them the confidence to go to proper medical facilities like hospitals rather than just the healthcare center. And they were very happy about that. We signed up 4 of the women that were positive for hepatitis B, because couldn't afford it, but we paid for them. We enrolled them onto the state's healthcare insurance scheme so that when it's time they would go, that won't be a hindrance for them and put them and their children's lives in danger. So one way is to also, besides getting the men on board and working in partnership with the men, is as much as possible to find avenues to educate them. So every time we go on our outreach, we start with a session where we talk to the women about these things. So we bring doctors, we talk in English and in their language. We use Hausa because we're here in the north, so that the women have a better understanding. We also want to work through faith leaders to be sure that the message is out. They have a session to just talk to them. Then also the other thing we are doing, S4G has got a grant. We applied to the United Nations Global Environment Facility Small Grants Program. We applied for a grant there to support the smallholder farmers on climate smart agriculture, because we feel that a lot of these decisions are hindered by economic power.
Yeah,
So if
exactly.
we're able to help them have sustainable means of livelihood, they can take a number of decisions that they need to take because they can afford to pay for things. So they can pay for health, they can need to learn a thing or two. And then I think the home is happier when there is something to eat, when there is food. Because one of the, so you didn't go to hospital, they tell you when we're still thinking of food to eat.
Exactly. Yeah.
So there's no food, so why are they buying medicine? And so it's a difficult situation. You find some of these people, and it actually can be sad and depressing sometimes, but we have our goal, our eyes are set on the goal to ensure that we can contribute what we can to reducing maternal mortality.
I must commend you. Such a great work you're doing. And like I said earlier, I'm going to post your link. And if you have maybe accounts, any access to what you do, your project, so that people can also donate, because we need a lot of funding. And I love to see that people are doing something, and whoever can support, that is passionate about this, can also donate something. So I'm going to share it to my network as well, so that anybody that have anything can donate to help these women, because obviously a lot of help and change is needed, and you're doing such an incredible work. So thank you very much for your time. This has been so enlightening just to hear you speak, and that's also challenged me to begin to do something also in developing countries and help out instead of just waiting for the government as well. People like you are taking that initiative to do something and apply for grants and go out there and try to make the change that we are talking about. So it's really commendable. So this is the end of season 1, and we'll be starting season 2 soon. So a lot of voices. I'm just trying to reflect on all the amazing speakers. And so honored to have a lot of people on the podcast. So misinformation is real, and it's really detrimental to our health. So please, just a call for action for women to be careful about those decisions, to ensure that they are having the right counsel before they make that decision on where to have their babies, and also understanding themselves, understanding those pre-existing conditions that they have before embarking on childbirth. I think this is really important and critical. So before we go, any final words, just to summarize everything, and then we'll call it a day. Final words or calls for action.
Yes, a call for action really is we need every voice and every hands that we can, and every heart we can. Seconds for Good appeals to your good in terms of time, your seconds in terms of time, and your seconds in time in terms of seconds, in terms of things you have pre-owned as well, because we use that to sustain the work that we do. So thank you, and I'm looking forward to more opportunities to engage. We also look forward to having volunteers. So if you're in Nigeria at any time, please, we'll be happy to see you join us to outreach and support the work that we do. So thank you. Together, we think we can end maternal mortality. So let's partner for life.
Thank you for your contribution and being here. Thank you so much. Thank you for watching our Mother's Health podcast today. Remember, every mother deserves safe birth. Bye-bye.